Welcome to another edition of For the Health of It. I'm your host, Corian K. Paget, and today I have with me Dr. Chris Rayner. Doc, if you can, go ahead and introduce yourself.
First of all, thank you very much, Corian, for having me on the program. I greatly appreciate that, the invitation. My name is Dr. Chris Rayner. I'm an orthopedic surgeon and sports medicine physician that lives in Ottawa, Canada. I have been a community orthopedic surgeon for the last 10 years, and I practice in a community hospital, which is just outside of Ottawa. And my practice is primarily based on orthopedic sports medicine, but I also do joint replacements and I do trauma as well. So that's my primary job. And then as a side job, I own a business called Human 2.0, which is a integrated rehabilitation facility, which sort of melds together orthopedic sports medicine, physiotherapy, and fitness and performance training. Mm-hmm. And so that's my side job. And then the last thing that I do is a content creator for YouTube. Produce videos on orthopedics and sports medicine injuries under the name of Dr. Chris Rayner on YouTube.
Okay. All right. So let me ask you this, Doc. You brought up some good things there about introducing orthopedic surgery and sports medicine and fitness and kind of combining all three. If you could please, I was going to save this question for later, but since you went ahead and brought it up, let's go ahead and talk about it. The ACSM, American College of Sports Medicine, they started an initiative almost 10 years ago, may have been 10 years ago, maybe a little more, called Exercise as Medicine, to try to curb the rise of obesity here in the U.S. Can you explain or talk about how the benefit of exercise can help the body?
Certainly. So exercise is something that I believe is very strong, and I think it's something that's very important aspect of our lives. And the way that we look at fitness and exercise now, we look at it as something that is separate from what we do the rest of the time. So you work, and then you play, and then you do exercise. But it's something that should be, that I believe should be something integral to our lives. So it should be just something that is a part of what we do every day, and it's not something separate. And you ask the question, well, why is it important for us? Well, it serves a number of purposes. And first and foremost, I think exercise is something that allows us to provide our body with a type of sustenance that it requires. So we need energy to fuel our cells and to allow us to allow our organs to perform their functions and our brain to work and our heart to beat, all those things. We need energy to provide or to do those things. But our body needs other things as well. One of the things that it requires is movement in order to allow us to maintain the strength of our bones, mm-hmm. the elasticity and the strength of our muscles, the mobility of our joints. It is a physical type of nutrient or sustenance that our bodies require. So first and foremost, I think it's important because it allows us to keep all of those musculoskeletal systems in shape. But it's also important, quite important, because it allows us to make sure that all of the processes, all of the physiological processes within our body are working optimally. And so this includes your cardiovascular system, your pulmonary system, your digestive system, your hormone or endocrine system. All of these things function with a certain balance, and that balance we call homeostasis. And any time that we are not active and not sort of using those systems at their optimal level, we can fall out of this balance of homeostasis, and that's when problems start to occur. And so if you consider, for example, you mentioned obesity, and obesity is associated with high incidence of diabetes,
right.
or as a lot of people in the South call it, the sugar, right?
Yes.
And then diabetes is in turn associated with cardiovascular dysfunction, so problems with your blood vessels and with your heart, and it leads to strokes, heart attacks, angina, and other problems with cardiac dysfunction. So all these systems, we need, all exercise is something that allows us to make sure that all of these organs are sort of functioning at their optimal level. It allows us to maintain the proper balance between the systems and within our body, and it helps to fend off many of the problems that are associated with sedentary activity. It's interesting that if you look at sedentary activity or inactivity, the incidence of disease increases with the amount of sedentary activity you have. So, and this is true of almost all disease. So whether it's metabolic disease, whether it's cancer, whether it's any type of problem that you can think of almost is associated with sedentary activity. So the more that you can exercise and remain active, the less sedentary activity will be a part of your life, and then the less likely you will be to have disease, almost any disease, occur in your life. So it's important because it helps us to avoid disease and avoid dysfunction. It helps us to maintain the optimal level of homeostasis or balance of all of the physiologic processes, and it helps us to maintain our skeleton. And it's interesting that people talk about doing exercise and going to the gym and getting jacked and all of that.
Right. Gains.
But what people don't, of course, the gains, right? And a lot of people who don't want to go to the gym, they go, oh, I don't want to get big. But really, we're not working out, and you shouldn't be lifting weights necessarily to get big, although some people are.
Mm-hmm.
You should be working out and lifting weights because resistance exercise is good for everybody. Because lean muscle mass, the higher your lean muscle mass is, the higher your metabolism is. The higher your metabolism is, the less likely you are to have diabetes or have cardiovascular dysfunction, and the less likely you are to be obese. So everybody should be doing that because it's better for them. Elderly people should be lifting out and doing resistance training because they have a higher lean muscle mass, they have better balance, they're less likely to fall and injure themselves. So there are many, many reasons why exercise is important and why people should incorporate exercise into their daily lives.
Okay. I appreciate that, especially at the end there. I don't think I went into this so far on my podcast, but I actually majored in kinesiotherapy in undergrad, and the head professor for that program was Mr. Purvis, Jerry Purvis, and he actually used to say all the time, exercise at this age can prevent such and such, or like you were just saying, especially with the elderly patients, we had to write a paper on osteoporosis and compare it to arthritis. And I didn't realize how different those two diseases were. But the fact that you just brought up how exercise, especially resistance exercise, can help with the balance for one factor with the elderly population, considering I just lost my grandma about a month ago. But the onset of what happened to her was she fell. And when she fell, she broke her hip. And then they're like, well, what happened after that? And then it went in, and it found. Long story short, she ended up having cancer, bone cancer. I'm not too sure of the term, but no lie. Just to be honest, she is my grandma. She was an overweight lady, obese lady, and had she took better care of herself, maybe she would have had a prolonged life. Maybe she would have had towards the end a higher quality of life. So I do appreciate you bringing that up. That's very good. I like that.
Sure. For sure. And as I mentioned that part of what I do is trauma.
Right.
So I routinely operate on hip fractures.
Mm-hmm.
And what the thing that people don't understand with hip fractures is that if you take all hip fractures, okay?
Right.
So if you look at hip fractures in the young and the elderly, all hip fractures, the 1-year mortality that is associated with hip fracture is 60%, okay? So that means if you had 100 hip fractures, at 1 year, 60% of those people who had a hip fracture are going to be dead.
Wow.
Now, if you take out of that the young people, right, the people who fractured their hip because of some freak accident, car accident, or whatever.
Well, quick question. How do you define young, or how are you quantifying young?
Young,
Right
so from an orthopedic perspective, young is anything under 55.
55.
Okay, but yeah, 55.
Okay.
But if you just take when I'm saying young for the purpose of talking about these hip fractures,
right.
Let's just say if you took out anybody who's under the age of even 60.
Okay.
Because it's very unusual for somebody under 60 to break a hip.
Right.
So say you took out everybody under the age of 60, then the 1-year mortality would not be 60%, it would be higher. And so that means that there is a very high association of death with the hip fracture. But yet, many of these people who have hip fractures, the hip fractures could be avoided if they had better lean muscle mass, better body control, better balance. And some of these things can't be controlled because some of these things have to do with eyesight. Some balance issues have to do with eyesight, or they have to do with brain issues, mm-hmm. from stroke or mm-hmm. whatever. But for the most part, if these people were more active, they exercised more, had better musculoskeletal control, then they would be less likely to fall. And I would bet that you could substantially decrease the mortality that's associated with hip fractures if if we had all of these other people working out and strength training. It's funny when at our facility, I tell everybody that we treat everybody as if they're an Olympic athlete.
Right.
I don't care who you are, how old you are, whatever. We treat them all as if they're Olympic athletes. And for some people, their Olympic sport may be just going to the grocery store, carrying their groceries, and picking up their grandkids. That's their sport. But I'm still going to train them the way that I train everybody else. And I don't care how old you are. We've got 72-year-old, like people who are in their 70s, and we put them under the barbell, man. We put them on a squat rack,
right.
And we say, look, this is what you should be doing. And granted, we're going to scale the weights accordingly to what they can do, mm-hmm. but people know when they come into our facility, you come here to work,
right.
and we're not trying to say, oh, you're old, so you got to sit in a chair and lift this 1 pound weight. Get out of here, man. We don't believe that. We're going to make you work, and you're going to work the same way that everybody else is working.
All right, that's definitely true, Doc. So before we go any further, I do want to, kind of go back a little bit. Let's look at your background, Dr. Rayner. Where did you go to medical school?
So I went to medical school at a school called University of Western Ontario. It's now called, they've changed the name now, it's called Western University. But it's basically Canada's equivalent to one of the Ivy League schools.
Okay. All right. And did you do your residency there, or did you do your residency somewhere else?
So I had a little bit of a roundabout educational path, uh-huh. because I was playing. So I played football, university or college level football when I was in university. So when I did my undergraduate degree, my marks were not as high as I would have liked to get into medicine. So I did my undergraduate at Western. I went back to upgrade, and I did a master's degree, mm-hmm. in biochemistry at Western. And then I also did a teaching degree, which was 1 year at Western. And then finally I did medical school there. And then I left Western and I went to the University of Ottawa in the city where I live now. And I did my residency in Ottawa. And then after that, I went back for 1 year. So at the completion of my residency, I am a board certified orthopedic surgeon. Although board certified is an American term,
right.
So we don't have board certification. What we have is the Royal College. So basically, we do a test at the end of our residency, and the Royal College certifies you as a fully vetted orthopedic surgeon. So at completion of my residency, I did my fellowship certification exam. So I was fully certified, and then I went back to Western again for 1 year to do sports medicine and arthroscopy specialization, and then I moved back to Ottawa after that.
Cool. All right. So you mentioned how board certified is more of a U.S. term. I want to ask you, because my wife is a physician, and before she got into med school, she had to take the MCAT. Do y'all have the MCAT, or do y'all have something similar? Or so y'all do have the MCAT.
So we use the MCAT now. Not every. There are 16 medical school programs in Canada. Not every single program uses the MCAT for admissions. Mm-hmm. So the program that I went to, Western, they did use it, but there's a program 2 hours down the road called the Master, which does not use it. And so each school, it's their preference whether they want to use it or not. Most of them do use the MCAT to some degree, and it's each program weights it however. So in my particular program, at the time where I was admitted, the MCAT was 1/3 of your overall score.
Gotcha.
Your interview was another third, and then your autobiographical sketch was another third.
Okay, makes sense. All right, so I want to fast forward a little bit. You have a video on your YouTube channel. That's actually how I first found you, to be honest with you. If I'm gonna, I found you on YouTube, then I took your YouTube name and typed it in on Instagram, and I started following you. And then when I got the courage to hit you up, I hit you up. So I do appreciate that. I appreciate you hitting me back.
Like I said, I'm always looking to get back, man.
Good deal. You have a video called "Train for Injury Prevention, Not Looks," and we went into that a little bit earlier. But can you go a little deeper into that?
Yeah. So we kind of joked a little bit earlier on. We talked about what people are working up with gains, right? And there was a time in my life when I was playing competitive football. I was trying to play professional football in Canada, and I was all about the gains, right? And then even after that, like when I was going through medical school and doing my residency, I was a fitness instructor. Both my wife and I were fitness instructors for 10, 15 years. And during that time, I'm still kind of in that mode. It's all about the gains. I just want to get jacked. I want to look huge. But then, as I started to go through orthopedics and I started to learn more about our bodies, then I started to think, it's not really about that anymore. Right. Because for the vast majority of most of us, we're not playing in the NFL. Right. We're not playing in the NBA. We're not doing something where we're not doing a sport where it is our occupation, right? It's just something we do outside of the rest of our lives, right? It's outside of our job and outside of everything else. And so when I started to think about, or when I opened up our facility, we wanted to have a movement-based rehabilitation facility. So we did that. And then as I started seeing patients in my practice and patients that are coming in, I'm having all these people who come in and they are training, because they want to get jacked or they want to look good and whatever. But yet, when they are active in their sport, which they are doing recreationally, or sometimes not even when they're doing sport, when they're just walking down the street or slipping on ice or whatever. When I would see these people come in, these people are hurt. And it's like, wait a minute, these people are active people, and they are somehow still managing to injure themselves when doing these things. And when you really look at it, one of the things at our facility that is very important to us is movement quality. We are big
I like that.
Movement quality. I would much rather you lift 5 pounds, but do it properly and with the proper body mechanics, then you lift 405 pounds and your body is all flying all over the place, because all that demonstrates to me is that you have no ability to control yourself. And it's when we were one of the things that we started to do at our facility, when we were looking at this movement quality, we started to follow this guy named Ido Portal. Ido Portal is a quote-unquote movement guru, and he was all about, his philosophy was about having people learn how to control themselves in space. And he said something that when I heard it the first time, I was like, that dude is right. That makes so much sense to me. And the thing that he said is he was talking about sports specialization, people taking their kids and learning how to play all these sports at a young age, and hyper-focusing on a sport. And he said, most people don't know how to move or control their bodies.
Right.
And if they cannot do that, if you cannot control yourself in space, why would I hand you a piece of equipment, a sport apparatus, a ball, a club, or whatever, a racket? Why would I do that, right? First, learn how to control yourself, right? And so for us, it's very important that people learn how to control themselves and control their movement, and before all else. And so that is a very big focus for us, and for myself, I think that is quite important. So to bring this back to the question about video, my whole philosophy now is, as I said to you before, in our gym, in our clinic, we treat everybody like they are a world-class athlete, and we are training everybody for whatever their sport is. And for some people, their sport is life, right? And so, but for the most part, what we want you to do, we want you to be able to control your body in space to the best of your ability, so that you can minimize your opportunity for injury and maximize your potential. So, interestingly enough, if you look at the people who train themselves to control their movements, right? Like the people who do this the most, or sort of the best, are kind of like gymnasts, who are, who they don't really have an apparatus. They do themselves without an apparatus.
Right.
And when you look at them, if you said to people, and you look at a gymnast's body, right? They're not training to look good. They're training to be functional, right? But if you were to line them up and look at their body, and then you were to get people to say, hey, would you want to have that body? Most people would say, yeah, I want to have that body. But they didn't train to look that way.
Right.
They trained for function. And so my point in that video was that we have to stop. We have to get off of this fitness merry-go-round, right? Where it's like train for the games, train for this, train for that. We have to get off of that, right? Because they're trying to get people to chase this ideal look, whatever it is, that is like not attainable. But yet, if they just train to be functional, as a byproduct,
it will come along.
You would end up looking the way that you would. It would come along for the ride,
there
right?
We go. Yes,
because
sir.
It's just a byproduct of what you're doing. It just comes along.
All right, I like that. Not to bash on my wife, but we actually had an argument about this. She may not remember this, but I remember this conversation because it was a conversation I felt like I won. Right before we got married, I trained my mother-in-law.
You never win a conversation with your wife, so you know that, right?
That's very true. That is very true.
Even if you think you win, you didn't win.
Well, in my inside victory, in my mental victory, I was like, babe, I'm getting ready to train your mom, and she has all these comorbidity issues going on with her. And I basically told my wife, I was like, I'm not training her to get down to get to your size. Basically, my wife's like a super small size. I don't even want to put it on there because I don't want to be wrong and get cussed out. But I wasn't training her mom to get down to that. I was, like you said, training her to be more functional. And I was actually telling my wife that like you said, if you train for that purpose, that's going to come along with it as a byproduct. So yeah,
of course,
I do like that. I do like that.
She's going to be able to move better, right? She's going to be able to do more, and as a function of her moving better and doing more, she's going to be smaller and slimmer because she's going to be active. She's going to be feeling better. Like it's just going to come along then.
Right. Very true. Very true. So, Doc, we got you here, and like I said, I'm a fan of yours. I've been looking at a couple of your videos. I haven't had a chance to watch all of them, but I have noticed you have a lot of wrestling videos or wrestling injuries on your videos. Are you a fan of wrestling?
Well, so here's the deal. When I was younger, I was a big fan of wrestling. My mother used to watch wrestling all the time. We always used to watch WWE, and before that, the WWF.
Right.
And when wrestling came to my town or to my city, we would go and watch, and those were the days of like the Iron Sheik, and I can't even remember all the guys at that time. But this was quite a long time ago.
Right.
So I was a fan of wrestling, and I watched wrestling up until and including when I was in high school. In university, I stopped just because I just didn't really have the time between doing a science undergraduate and then also being on a varsity team. There was no time, right? So I had no time. And after that, getting into my other stuff and having kids, no time to watch. So I stopped. So obviously, I'm an orthopedic surgeon. I do sports injuries, so that's what I want to do my channel about. When you see me on the channel, that's the way I am in real life. I'm a joker. I'm just kind of lighthearted, and I kind of like to make things humorous. So I try to have that angle when I'm doing my videos, and I kind of was looking for different things. I'm trying to grow the channel,
right.
So I'm always trying to look for topics that are interesting, but that have a lot of traffic on YouTube.
Gotcha.
So I thought one day, hey, I'm going to do wrestling injuries. So I did a wrestling injuries, and wrestling injuries was one of my first videos to blow up. So I have right now I'm at 52,000 subscribers, and I've grown over 2 years. A year and a half, almost 2 years, I've grown the channel from nothing to 52,000. And I have most of my videos get anywhere from 2,000 to 10,000 views on average.
Right.
But wrestling, I was one of the first ones to blow up. Where I don't know where my first wrestling one is now, but it's probably at 500,000 or something like that.
Wow.
And it's a couple 100,000 at any rate. So, as I'm trying to grow the channel, I'm always trying to pick things that people resonate with. And I have to tell you that the wrestling people, the wrestling fans, of all the people of all my subs on YouTube, the wrestling fans are the most rabid fans of all.
Yes.
They love their wrestling, man. And so, from my point of view, I'm trying to grow this, so I'm like, okay, they seem to gel with that. I'm going to do some more wrestling videos. Right. And as I keep putting out more wrestling videos, I'm researching and reading and learning more about wrestling. So then it's like, hey man, I really don't have a lot of time to watch TV.
Mm-hmm.
But it was funny because, now every once in a while, if I'm flicking through channels, if I'm sitting down for 10 minutes, I flick through, hey, there's wrestling. And I'm like, found myself watching wrestling stuff. And it's funny because I know, the age-old argument, wrestling's not a sport, it's not real.
Right.
You know what? What they do is very physical, and I've come to appreciate this and learn this. What they do is very real, very physical, very hard on their body. It is scripted. It's entertainment.
Right.
Okay? And that's the one thing that I have learned to describe it as when people talk, because people will say things on the comments and they'll argue back and forth. I try to stay out of the arguments, and I just say, look. From my perspective, these injuries that they suffer are real, and what they do is very physical indeed. Jumping from the top rope and jumping off top of the cage and holding a grown man up in the air and suplexing him to the ground. That stuff is hard work, man.
Right.
But it's scripted, right? So it's entertainment in the form of, hey, I know I'm gonna fight Corian and at the end, Corian's gonna win. I'm gonna lose. He's gonna get the belt, and there's a storyline to maintain. So that is predetermined, right? And the stunts that we are gonna do is predetermined. But still, what they're doing, that's hard, man. That's hard and physical. And my hat's off to those guys, man. Because I like, holy crap. I know what it's like to hit and get hit playing football, right? And these guys don't have no pads on. They have no pads, and not only are they hitting each other, they're hitting the floor.
Exactly.
That's crazy.
Exactly. That is very true, Doc.
But to answer your question, I am sort of an outside fan, but it's kind of, I don't know if you're familiar with Star Trek at all. Star Trek, they have one race of computer beings that are called the Borg.
Okay.
And the Borg always used to walk around saying, they have in this monotone voice, you will be assimilated, you will be assimilated. Because basically they just overran everything, and they brought everything into the computer.
Right.
So I kind of feel that way with the wrestling fans, because it's like I'm trying to just be neutral out here on the outside and just comment, and then slowly it's like I have these wrestling people like, you will be assimilated, you will be like, you can't fight them, So
that's very true. I can't lie, I am a wrestling fan. So yes, you will be assimilated. But in all seriousness, I actually interviewed my first professional wrestler yesterday, and I'm releasing a video tomorrow. So it's pretty cool that you were able to associate the realness of their injuries and how that happens to affect them. Like you said, it may be scripted, but again, the injuries are real. I got a couple more questions before I get you out.
No problem.
You are the first physician I've had on. I probably should have had my wife on by now, but it's gonna be all right.
Oh my goodness!
Please let me make it. Let me make it.
Have your wife on first.
Since you are the first physician, if you could give me a brief overview of the coronavirus.
Sure. So I did a couple of videos on this, and not because I'm an expert on this. I am not.
Right.
But I wanted to be able to speak. I think that one of the things that I am good at in my line of work and also the videos that I do is taking topics that are complex and making them simple for people. Because I always try to think I'm explaining something to my parents. And I love my parents. My father's passed. I love my parents very much. But my parents had only a grade 10 education. Mm-hmm. And so when they would go to the doctor, they would always call me afterwards because they'd want to know what the doctor said and what it meant, right? And so I always feel like I don't want anybody to leave my office and have to call anybody, right? I will figure out a way to explain it to people. So the coronavirus, what I'd say about it is this. So the coronavirus is a new virus. And what I mean by that is it is a virus that our population has never seen before. It is from a family of viruses called coronavirus.
Right.
So coronaviruses we have seen as a group of viruses. So it's a particular type of virus, which is a coronavirus, and we have seen those. We've seen that before with SARS. We've seen it before with MERS.
Right.
And we've even seen it with other types of cold viruses, the common cold virus. These are all coronaviruses.
Okay.
So we've seen this type of virus, but we haven't seen this particular one. And the reason why that's important is because the other viruses, for example, the common cold, it is present in our population at all times.
Right.
But we have a certain number of people who have seen it, and so there is a certain level of immunity that is present in our population. The problem with the coronavirus, the new coronavirus, is that because it has never been in our population before, every single person that comes in contact with this virus will be able to be infected because there is no immunity to it. Okay? So that's the first problem. The second problem with the coronavirus is that it is more infectious than is the regular flu, the common flu, and it is so it's more infectious, and in the people who are negatively affected, right? So it's easier for people to catch it, and 80% of the people who get it, they're going to be okay. They're going to have a mild thing, no problem. But in the 20% that do get it, they're going to get really sick, right? And so when you compare it to the common flu, it's scary because it's very easy to get. It's easier to get than the common flu.
Right.
There is no immunity to it yet. And for the people who become sick, they become really sick, right? And finally, the final thing that really makes this evil, and I kind of say that jokingly, it's not evil, it's just this virus, right?
Right.
But the thing that's sinister about this is that the incubation period for it is very long, right? And so normally for most things, if you got the flu, you come into contact with somebody with the flu, and a couple days later, you're going to get a fever, you're going to get sick, and then the period of time between when you came into contact with that person and when you came sick is only a couple of days.
Right.
With the coronavirus, the incubation period is between 2 to 14 days. So that means you could be walking around for 14 days with no symptoms whatsoever and spreading that virus, shedding the virus the whole time to everybody that you come in contact with. Before you get sick and people realize that you have it. And if you think for a second, okay, so you said to me, I just interviewed my first professional wrestler yesterday.
Right.
Okay? So you knew what you were doing yesterday.
Right.
Well, what did you do the day before that? And then the day before that? And the 14 days before that? And where are all the places that you went to for those 14 days? All the surfaces that you touched, all the people that you spoke to or breathed around. So when you start to think about those numbers now, right, like you probably can't remember every single place that you were, everybody you talked to, every surface that you touched, right? But if you think for a second that over the 14 days prior to today, all of those surfaces, all of those people, all of those everything became infected from you because the incubation period is so long. Then you start to go, oh my goodness, I probably came into contact with 200 people, right? And if those 200 people then got it, and they were asymptomatic for 14 days, and then they spoke to 200 people, like you can see how all of a sudden it becomes really, really easy to spread this thing, which is really infectious, right?
Right.
And nobody has any immunity to. So that's basically what the coronavirus is, and that's why it's a problem for us.
Gotcha. Well, that was a lot of information, and we certainly appreciate the education tip right there, Doc. Two more questions before I get you out of here. If you could, please name some of your favorite exercises that you love to do.
Okay. So one of the things that I think is most important that everybody needs to be able to do, the body weight squat. Okay. And I think is a fundamental exercise. And I think this for a number of reasons. Number one, because it forces a person to work on hip, knee, ankle mobility. It also helps them to work on core strength, back strength, and it is good for developing lower extremity strength and muscle mass. So for that reason, I think that the squat is one of my favorite exercises, and one that I think is very important. I also think that the hollow body hold is a excellent exercise, and this is because this is a great exercise for working on core strength, core stability. People work on their abs all the time, but they think they have to do crunches. You don't have to do crunches. You can do isometric holds. It's great for your core, and it's safer for your low back. Right? This is the problem with crunches. Crunches put inordinate amount of flexion stress on your your lumbar spine, and you don't need to work on your core. You don't need to do crunches to work on your core. So the arch body hold, the hollow body hold, and then its cousin, the arch body hold for your low back. Those are also two excellent exercises that I think are quite good. I'm a big fan of hanging, right? Right. And I think that just a dead hang from a pull-up bar, as I think is an excellent exercise, but also an active hang, which helps people to learn about scapular control and scapular depression for good shoulder positioning. I think that is also an excellent exercise. Scapular push-ups, I think, are great, again, for the same reason. I see lots of people with scapular or with shoulder issues, and if they had only learned how to control their scapula better, then a lot of those shoulder problems could be avoided. So let me think now. So I've done the shoulders. Oh, and so we also need to add in some type of torsional activities, and so there's a lot of different variations for that. But you can use bands, some exercise bands, and tie those to a rack or whatever, and work on twisting, whether that's axe chops or whatever, something to put in some torsional movements, because I think we do a lot of stuff in a linear plane, in either a frontal plane or sagittal plane, but we don't do anything in a transverse plane, so I think that's important. And then finally, the one apparatus that I think people should use and be accustomed to is kettlebell. And I love kettlebell swings, kettlebell swing snatch, kettlebell cleans, and kettlebell squats and carries. All of those things centering around the kettlebell, I think are amazing. And hold on a second, my wife is yelling something. What are you saying? Huh? I can't hear you. Oh yes, and she's just saying Turkish get up. Hit the kettlebell exercise, but yeah, the Turkish get up is an amazing exercise. Yes. It's very technical, mind you. Yes. But it is an amazing exercise, and you can get a ton out of that, even if you don't have to use heavy weight to get a lot out of that, right? You can use a small bell and still learn a ton. And it's funny, when people are training with us, at our facility. Oftentimes they'll come in for the first time, and they don't know kind of what weight that they should be using, and you'll see them pick up a weight, and we'll have to go over it and give them like a little pink belt or a little blue belt, because you say, look at man, and you're saying this is not. You have to leave your ego at the door.
Right.
Because we want you to learn how to do this properly, and I even find it, even myself, because again, the games monster, right?
Mm-hmm.
Bigger, faster, stronger. Yo, I'm gonna get doped.
Right.
That guy still lives in the back of my head, right? And every once in a while, he tries to get out, right? And then I have to say to myself, I am not training for the NFL at this point, right? I'm training so that I can be active and mobile now at 50, and also 30 years from now at 80, right? That's what I'm training for, right? So those are my list of exercises right there.
Okay.
Those are my essential exercises. If you do those, like you are, it's not the end all and be all, but you can do just those exercises and you're going to be golden.
All right, that definitely is a full body workout right there. I feel like somebody can get an adequate gains from that. So I definitely agree with you there, Doc. One more thing, we know what you do.
Yes.
You're a physician. You're an orthopedic surgeon. Now, I always got to plug my principal, Bobby D. Brown at Jim Hill High School in Jackson, Mississippi. He showed us a video of a guy named Michael Jr. And in that video, he had a guy that was a choir teacher. He said, we know what you do. You're a singer. You're a choir teacher. But why? And so the point of the video is when you know your why, your what becomes more impactful. So I want to know, why are you a sports medicine physician or an orthopedic surgeon?
Sure. So it's important for people to understand what their strengths are.
Mm-hmm.
When you decide what you want to do, you have to know what you love, right? And you need to know what your strengths are. And so for me, I love being active. If you were to ask my mother, she would tell you that I was an active child. I was nonstop running around all the time. Any sport, put me in it. Anytime I had an opportunity to play, I was there doing it. So I have come to learn that I am a kinesthetic person. I like to do things, and I like to work with my hands. I also I truly want to help people, and I think that I am good at helping people. Okay. And so when I think about those things, I thought, oh, geez, helping people. When we had career day and someone said, hey, you could be a doctor, you could help sick people, I thought, hey, that sounds like something that I would like to do. But when I think about what type of doctor I would want to be, well, I want to be a doctor that does procedures, right? Because I love to do stuff, I love to be active, and I like to use my hands. So then that drew me towards surgery. And then, I went through always being a part of sports. At some point, my heritage is Jamaican. I'm Canadian. I was born in Canada, but I'm Jamaican heritage. And my mother always used to say this quote: when you're a child, you can do childish things, but when you're an adult, you can leave childish things behind. Which is basically just saying, so when you're a kid, you do kid things, and when you're an adult, you have to do adult tasks, and you have adult responsibilities. Mm-hmm. And so at some point, I gave my shot to try and make professional football, and I was drafted in the Canadian CFL draft, and I went to the training camp, but I did not make the team. So at that point, I had to make a decision. Should I continue to pursue this, or should I work to get on with the rest of my life? Right. And at that point, I already had one child. Sat down with my wife, said, okay, I'm going to work to do the rest of my life. And I wanted to be a physician, but when I started thinking about what I want to do, I was thinking, oh, yeah, I want to be a surgeon, but I still found it hard to give up the sports, give up the team, and not be in that environment, right? And then when I started to learn more about the different careers, I was like, wait a minute, who are these sports doctors? How they do that? And I discovered, oh, well, you're an orthopedic surgeon. And I had already had my exposure to that because during my athletic career, I had knee surgery. So I had some exposure, and I thought, geez, look at these guys. They're orthopedic surgeons, but yet they're hanging out. They're on the sideline with the football team. Mm-hmm. They get to do all these things with their athletes. And I thought, you know, it's a way for me as an adult to still get a little bit of that childish thing for myself.
I like that.
Just hanging out with the team.
I like that.
Right? And it's like, I can play, so I'm good with my hands. I use my hands. I'm good with people. I can speak to people. I can help people, but yet I can still be with the team. Right? And it's in a different role, but I can still be with the team. And so that, in a nutshell, is why I am an orthopedic sports medicine physician.
All right, I like that. I love that answer, Doc. And before we get you out of here, Doc, if you can please plug all your social media accounts, your YouTube, your Instagram, Twitter, if you have it, and any other personal website.
Certainly. So you can find me on my personal website, which is Dr. Chris Rayner, ChrisRaynor.com. And then all my social media, so I am on TikTok, Dr. Chris Rayner. I am on Instagram and on Twitter at Stable Knees, STABLEKNEEZ. And let me see, anything else? No, I think that. Oh, of course, no. My YouTube, which is my YouTube, which is if they just look up Dr. Chris Rayner. They can find me there, and they can also find our gym and our movement facility on YouTube at Human 2.0, Human 2.0, and then you can also find us our Human 2.0 stuff on Instagram or Twitter under Human 2.0 as well.
Okay. All right. This has been another episode of For the Health of It. Dr. Chris Rayner, we definitely appreciate all the information you gave us.
Not a problem at all. Once again, thank you very much for having me. I thought it was a great conversation, and I'd love to be able to speak about what I do and why I do it. So thank you for having me.
Thank you.